Okay, if you are about to give birth, stop scrolling. My name's Sydney. I'm a labor and delivery nurse. And what's so important about the baby's umbilical cord being white? Let's talk about delayed cord clamping. When a baby is first born, they come out and the umbilical cord has two arteries and a vein. And this is what supplies all the nutrients and blood flow to the baby when they're in utero from the placenta. So the umbilical cord attaches from the baby's belly button to the placenta. Once the baby's out, we usually clamp the umbilical cord, and then baby is getting all its own nutrients and blood flow through itself. People started to notice was that we were cutting the umbilical cord too early, meaning that not all of that blood flow in the umbilical cord had gone through to baby. So we were cutting it immediately after baby was born for every single delivery. And we realized that that amount of blood flow, that cord blood, is really valuable and can actually be really helpful for baby. So we routinely nowadays wait 1 to 2 minutes of delayed cord clamping before we actually clamp and cut the cord. That way, that umbilical cord is white and it's no longer pulsing and getting blood flow from the placenta. Research has shown that this is actually extremely important for premature babies. So even if it's only 30 to 60 seconds of delayed cord clamping, it can really benefit a premature baby. And then full-term babies are less likely to be iron deficient at around 3 to 6 months after birth. One thing that is important to keep in mind is if baby comes out and is needing resuscitation, so they're not crying, they're really limp, they're blue, they're not transitioning well to the outside world, we will cut and clamp the cord earlier. This is so that we can appropriately ventilate the baby. So usually in these cases, ventilation is the most important thing. So we will cut and clamp the cord and bring the baby over to the radiant warmer and supply them with some extra oxygen and actually sometimes breathe for them. Usually after getting a couple breaths in them, they turn around really well. But at that particular moment, what is most important for that baby is to get air into their lungs. Delaying the cord clamping is not beneficial at that time. It is only beneficial if your baby comes out screaming, crying, and nice and pink, which is hopefully most of the time, but every once in a while we get a little stinker who has some trouble coming out into the real world, which can you blame them? I mean, they're coming from a really cozy space inside. ACOG recommends waiting at least 30 to 60 seconds, and the World Health Organization recommends waiting 60 seconds. I would say for most of my births, we do 60 seconds, but you can do a little bit longer if you want to wait for that whole cord to be nice and white and not pulsating. One side effect of delayed cord clamping is that your newborn might develop something called hyperbilirubinemia. Whew, that's a mouthful. Basically, all that means